Hi, everybody. This is Mark Graban. I am the VP of Improvement and Innovation Services from KaiNexus. Thanks for joining us today for episode 12 of Ask Us Anything. I am joined by Greg Jacobson, if you want to introduce yourself.
I'm the CEO and co-founder of KaiNexus, and I'm really looking forward to the 5-7 questions that we're going to knock out today.
Yeah, 30 minutes goes quickly. We've got a lot of questions we'll try to get through. We always try to start with something kind of in the realm of anything. When we say ask us anything, Greg and I are both big Spurs fans, San Antonio Spurs basketball. We like to talk about lessons learned from sports. Greg, do you have any kind of insights and thoughts about the Spurs and what you learned from watching them?
Yeah, so as we were kind of thinking through what was going to be the question that we add to this to give some color, I was thinking about, why do I love the Spurs and why has it become more meaningful to me as I'm going through my continuous improvement journey. And the Spurs are such a great example of applying a discipline and creating a system and then believing in that system and recognizing that if they follow a process, that the results will be a side effect, so to speak, of that process. You don't just randomly have the most successful professional franchise in all of sports history ever be by some kind of random event. It's kind of this discipline. You don't get to the playoffs 19 seasons in a row because of random events, right? So it's this kind of disciplined realization of that if you follow and stick with a process, that the results will come. An interesting statistic I just read is right now on the Spurs team, there are only 3 people that are in the current roster that were top 30 draft picks. Right. Every single other one is a lower than a top 30, and it just shows that kind of working through a system and working through a process, the sum becomes greater than the parts. And
yeah, I've seen the same thing. I've seen the same thing with the Spurs. I grew up in Detroit. I'm still a Detroit Red Wings fan. This year is the first year they had made the playoffs 25 consecutive seasons. Wow. I believe it was 3 Stanley Cup championships in that time, as opposed to 5 championships for the Spurs. The Red Wings have had a fairly similar playbook. The last couple of years, there's been some noticeable decline. Last year, they barely made the playoffs. This year, the writing was on the wall that it wasn't going to happen. But they've gone through multiple coaches, lots and lots of players. But there's been, I think, kind of a system, and they haven't been able to rely on high draft picks because they've always had good teams. So it's a similar dynamic. They have to draft smart. They have to develop players in the minor leagues. They have to have a system, and I think there's a good lesson there.
Great.
One other thing, the other night or about a week ago, I was watching, I don't know if you saw the Spurs play the Warriors, Greg?
Sure.
The Spurs jumped out to a 15-0 lead. They were ahead 23-3. The fans were going crazy. The players seemed to be enjoying it. And there was Coach Popovich. He was just scowling. He was, he, and I said to my wife, I said, well, I said, look at Pop. I paused it, and I'm like, why can't he enjoy this? But I think he's just always, I think for one, he never gets too high or too low.
Right. There's
kind of a calming, mellowing effect either way. And I'm sure there was something that he saw when you speak of continuous improvement and striving for perfection. There was something he saw about the way they were playing that made him unhappy. And I think that relentless drive to continue to identify something. I don't think he saw the writing on the wall. I mean, the Spurs ended up losing that game, unfortunately. But I think he sets the tone in some interesting ways.
So it's this constant focus on the process and not the outcome that makes him a great coach and lead a great organization. And that's what he was focusing on. He wasn't focusing on what the score was at that moment. So
yeah. Well, and when we think back to workplaces, a lot of organizations only react and troubleshoot when they get a bad result, instead of looking, say, well, if we've got a bad process and we happen to still get good results, maybe that's luck, and that luck is going to catch up to us. I saw last week, the vice president of quality from one of the Dallas hospitals talking about the need to focus on the process and not just react to results. And you do that through checklists. We use a checklist to prepare for these webinars. There's that relentless focus on the process and preventing problems instead of just reacting more quickly. I really appreciated his comments.
Continuous improvement is not sexy. It's just the disciplined way to end up with a really high functioning organization, whether that organization is, you know, a hospital, a summer camp, a software company, or even your family and you as an individual. A disciplined approach will have really satisfying results in the end. So,
yeah. Well, so we've got a question here. When we talk about these ideas applying anywhere around the world, we got a question here from Malaysia, from Benny, who asked about culture change. The working culture here in Malaysia, he's an industrial engineer, is very different than the one in Japan. The current situation in my factory is that the operators here do not want to engage in improvement programs because they feel it does not benefit them. How do I change that culture? How can I convince workers that continuous improvement is a win-win for them? I understand that in Japan, workers do continuous improvement because they see it as an achievement and no rewards or prizes are needed to motivate them. So my first comment to this, I've only been to Japan a couple of times, and when I visited Toyota, our tour guide, she was a woman who worked in the public affairs department. She was, I think, essentially a full-time tour guide and did other public relations work. During the tour, we asked her, have you gotten to implement a Kaizen? She was talking about Kaizen. And she said, well, yeah, I have. And she showed us where, as we went through the tour, there are various spots where she was supposed to stop and talk. And in each of those places, there was a hook for her to put her bag. It was, I don't know if it was a purse or a briefcase. It was kind of in that in-between. And she said that those hooks were her Kaizen idea, that she didn't like setting her bag on the ground, even though the plant was fairly clean. It was her idea for the hooks. And she said she talked to her supervisor. She mentioned the idea. The supervisor said, yes, maintenance installed the hooks. That was purely out of self-motivation. She didn't want her bag to get dirty. And so I think there's an important lesson there, whether it's Malaysia or what I've seen with hospitals in Thailand or organizations in the US. The way you show employees that Kaizen is win-win is you ask them to come up with ideas that would be a win for them. That ends up being a win for the organization. You seek out those opportunities, right? What do you say?
I like to phrase it as, what frustrates you at your workplace? That's just an easy place to start. What we see almost invariably when an organization is truly doing that kind of bottom up, they recognize that 80% of their improvement potential is sitting in the front lines. How do we unlock that? Right. What we see almost invariably is that if you look at the categorization of the improvements that are implemented in that first year, staff satisfaction takes an overwhelming majority of the percentage. We often see over 50% of all improvements in that first wave. Then if you keep tracking out over time, you start seeing things like safety, quality, finance following, because they kind of got rid of all the things that were bothering them, and then they could see past their own 1 to 2 feet and really delve into the process. So it's a great way to get buy-in, and it's a great way to, there's a staff morale issue. There is probably an added safety benefit of the hook, right? I mean, someone may have tripped on the bag, who knows? Right. So what's so interesting is the intended impact sometimes is not the actual impact of an improvement. Right. Sometimes you just, the classic example we talk about with this, Mark, was the nurse that said, hey, wouldn't it be great if we just called in the patient's prescription to the pharmacy, our local pharmacy right down the hall, and so when they walk out, the prescription's ready. Well, the unintended benefit of that was that it increased the pharmacy's output by over $200,000 a month, because some of these were some really expensive prescriptions. but it was actually done for patient satisfaction, you know?
Right.
So to me, that's the best place to start, is just what bothers you, and let's fix that. And I don't know if it's a cultural thing, because we also know plenty of places in Japan that aren't doing Kaizen well at all. Yeah. So it's not just, oh, well, you just need to be Japanese and this will just magically happen.
Yeah, and I think there's powerful lessons about tapping into intrinsic motivation, whether, it's Masaki Imai and the book you and I both read and been inspired by, his book Kaizen, talks about, you just want people participating in the improvement process. More, current, Masaki Imai is still around, but Paul Akers, in his book 2 Second Lean, he asked people, come up with a small improvement that'll save 2 seconds in doing something. A little bit of time savings can have that dual benefit of reducing frustration, making your work easier, and having benefit in terms of capacity and output for the organization, which can have financial benefits. So I think we go looking for win-win, and even if we err on the side of being only a win for the employee, like you said, Greg, a lot of times really that ends up being win-win for the organization. They start participating, and then over time you discover they are coming up with ideas that very directly save money, which I think is different than organizations that focus too much on asking people to do cost cutting. That doesn't engage people the way finding something that makes your work easier engages people.
That's great. I think it's going to tie into the next question as well. Do you want to start with that one?
Yeah, well, I was going to make one other point when it comes to incentives or rewards. I think there's two mental models that organizations and leaders often have before they start with Kaizen. One is, well, we've got to make it mandatory. We've got to require participation. So, well, no, if you invite people to work on problems that matter to them, you're tapping into that intrinsic motivation. The second assumption is, well, we have to give an incentive. And I've seen, if leaders are engaging people in this Kaizen style, people will participate because they want to, because it's interesting, because it's in their self-benefit. And sometimes the idea of doing rewards and incentives just becomes a bureaucracy that can be a distraction or gets in the way.
And if you want to get into the nitty-gritty of the social science behind this, Daniel Pink's book Drive, it kind of breaks down the science behind this. I think, we're talking to one of our customers, and they had a quota for a number of improvements per employee per year. They actually gave us some feedback, and we are going to be releasing, I think, in the next version, a feature that they came up with. One I've been wanting to do for a long time, but I'm fanatical about waiting for a customer to kind of sponsor it before it finds its way in. And we called it a target line, and they subsequently have kind of redirected their thought process here and said, oh, well, we're not interested in quotas anymore because of the exact reason you mentioned. It creates really bad behavior. I don't think that means that you can't have a target or a goal, right? It's a matter of, we would like to see 1 or 2 improvements or 5 improvements per person per year. That's not saying we're going to make it we're not going to get to that by making it mandatory that people do that. We can still set that target or that goal and not do quotas. And certainly, I think knowing where you want to end up is really important to the success of the journey that you're going on. So
yeah. I think there's a difference between an aspirational goal and a quota. If you don't reach an aspirational goal, you learn from it, you adapt, you move on. When you've got a quota and people fear getting in trouble for not hitting the quota, that's where things get really dysfunctional. Okay, but moving on, the next couple of questions are also about gaining buy-in. We've talked about getting buy-in from frontline employees. Next question is from Audra. What is the best approach to leaders who still don't embrace CI, especially with allowing those who do the work to drive the improvement opportunities? Greg, do you want to address that first?
Yeah, we could probably spend an hour on this and alone, and I think we probably have dedicated webinars to this. But in the reason why I thought the first question related to the second question is because to me, what we're ultimately talking about is conflict resolution, right? And in conflict resolution, one of the principles of it is finding a common ground, right? And so we talked about in the prior question, well, how do you engage the front line? And we said, well, just find a common ground of what frustrates you and let's go fix that. I think the same thing applies to senior leaders, right? Find a common ground. What are their goals? What are they trying to achieve this year, this month, this, over the next 5 years? And don't talk about continuous improvement, right? Just talk about those goals and then figuring out, well, how can we move the needle to start accomplishing those goals? And what you'll end up realizing is that they'll be doing continuous improvement before they even realize it, and you don't even have to talk about, Hoshin or strategy deployment or control charts or A3s, and it's kind of getting that kind of core of improvement science as being part of just what we do versus, oh, we're going to do this program called lean, and we know that doesn't work, right? It's more of a lifestyle and it's a practice versus a something we're going to start on Monday.
Yeah. Yeah, and we can combine, the next question was from Martin, who asked, how do we get senior management's buy-in on CI? I think you've touched on a lot of it, Greg. Doing continuous improvement or lean or Kaizen or whatever we call it should be a means to an end. We don't want to do lean because it's somehow the right thing to do or because it's trendy. We should be, over time, driving sustainable long-term results for the organization. And that's not just cost and finance, but as you were saying earlier, it's safety, quality, customer satisfaction, employee satisfaction. So there's that combination of bottom-up employee ideas. What bugs you? What do you see? What can you fix? And then there's also top-down guidance. Here are the directions and the strategies of the organization. Here are the goals that we need to accomplish this year. But then leaders don't dictate all of the how. They might talk about what and why and expect more of the what and how at a detailed level to come from more of the bottom up. So we're going to set goals. We see this in what you call strategy deployment or Hoshin, Conry. Executives and leaders still set direction, but then we ask employees and managers at different levels to figure out how are we going to accomplish goals in their local department and organizationally. But one other thing I would add, I think if leaders don't embrace this approach to continuous improvement, I hear all the time people ask, how do we convince people that this will work? I said, well, let's try. Let's do a small test of change. Let's do a pilot. Let's demonstrate that A, people will participate, B, they'll keep participating, C, that it's going to be driving all sorts of benefits in that small part of the organization, prove that out, and then expand.
And I think it's, the word align comes to mind. Whenever I think of kind of Hoshin strategy, I think of the word align just in my head on thinking through this. I think of, hey, it's great to have one problem solver, but what about a team of problem solvers or an army of problem solvers? And then I think one of the best ways to continue to make sure that your leaders, once they do the experiment, once they're like, okay, cool, we'll do this experiment, I'm going to authorize energy be done towards this type of behavior, is to make sure they have visibility into the impact. And we talk a lot about that. I think it's something that software really brings to the table to be able to do that. But whether you're doing it through KaiNexus or Excel spreadsheets or just on paper, you really need, it's just like you said, if there's a different way to improve to get to the end, by all means do it. I mean, we just happen to believe that we haven't found a better system out there to get the results that we're all looking for. And so making sure people understand what the results are is going to be critical to understanding. It's kind of like, if you don't know what the score of the game is, then it becomes really hard to know if you're playing the game right, if that makes sense. So.
Okay, well, we've got another question that came in from April, who asked.
From April, like the month, or April the person?
April the person. It's an April question in April. Greg, you're being an April Fool.
I just taught my 6-year-old daughter about April Fool jokes. We had a blast on April Fool's Day. Anyway.
Well, before we get into the question, there was a nice April Fool's post on the KaiNexus blog that Maggie Millar wrote. I would encourage people to go and look at it. The KaiNexus KISS system.
Add-on. Yep, we worked on that for months. I hope everyone really gets a lot of value from it.
how to apply continuous improvement to your family and your life at home, right?
Exactly.
But April's question, so a lot of times when Greg and I talk about Kaizen, our default almost always means small, staff-driven continuous improvement ideas. The phrase Kaizen event, to me, that's a form of Kaizen. So April's question was, when planning a Kaizen event, in healthcare, people often call these rapid improvement events, what is your process? After clearly defining the problem and business case, how do you determine the scope and the goals? So I'll throw out a couple ideas. One, for a real kind of detailed deep dive, I do recommend a book called The Kaizen Event Planner by Karen Martin and Mike Osterling. If you go to Karen Martin's website, you can just do a Google search for Karen Martin Kaizen Event Planner. You'll find her website, Karen Martin Associates. She's got a lot of free webinars, a lot of really detailed information, and I recommend the book. But the Kaizen event is usually 3 to 5 days. It can be shorter, but let's call it a week-long Kaizen event. The work to plan the event is usually greater than the week itself, where people might start 8 weeks in advance, defining the problem, doing an initial Kaizen event charter, forming a team, collecting data, and I think the question around determining scope and goals is an iterative discussion. You've got your starting point, and then you talk to your leaders and you get their input and you refine the scope. Someone might give guidance to say, nah, that seems too big, narrow that down a little bit. You're forming the team, you're doing some initial pre-work before the event, and you may learn from that and change some of your scope accordingly. So I think of it as an iterative process as you're getting ready for the event, and I think there's a real strong correlation between the amount of planning and the quality of planning and the expected outcome of the event. So it's by no means a situation where you plan and have the week scripted and you know exactly what's going to happen. That wouldn't be a good event. But you've certainly done the work to make sure you've got what seems like a reasonable scope, that you've got who you think are the right people involved, and that you've got the ability to actually go pilot some changes instead of spending a week coming up with a to-do list. So I mean, I think that's my general question to April, or my response to April's question is to spend a good amount of time on that up front, and don't expect to have the perfect idea right away. Do some iteration.
Yeah, and I think the only thing I can really add to that is from a KaiNexus standpoint, where does the platform, where does the software come into that? And then I'll make one caveat at the end about my thoughts on events in general. But that whole planning process of the iterations on figuring out what is the scope, perhaps there's going to be some documents that need to be tracked along, perhaps that the charter is evolving over that 4 to 8 week process. All that can occur very well, and almost all of our customers are if they're doing events, then they're using KaiNexus to help manage that event. What's interesting is that a lot of the magic of the event happens because people are in a room and there might be some butcher paper, or they go out into Gemba and actually roll up their sleeves and figure out what the process is. Documenting what happens there is probably the only way the KaiNexus platform is going to be used during the event, because that magic really happens when people are talking and conversing and kind of iterating. And then what we constantly heard, and it was actually the initial problem that we aimed to solve by building the Kaizen event management features in KaiNexus, was that follow-up process where people said, oh, we got 30 improvements out of the event. We did 7 of them during the event, but on that 30-day check-in and that 60 and then 90-day check-in, nothing was really happening because the team didn't have an asynchronous way to all stay together to make sure those are happening. And so what we see is people that manage Kaizen events in KaiNexus are able to make sure all those improvements end up getting completed. Whether they create a change or not is just a determination of what the actual problem they're looking to solve is. But that's kind of where KaiNexus fits in. And then my one other comment, and I looked at events initially way before I knew Mark, when I was just learning about Kaizen, and my initial take on them was, wow, nothing continuous about events. Events sound like episodic improvement, which we know doesn't create a culture of continuous improvement. And once I started talking with Mark, and he started explaining to me that the popularity of events has really been a manifestation of kind of the consultant culture, because it's very easy for a consultant to come on site for a week and really help kind of spur and lead that process on. That's not to devalue the value of events. Events certainly have their place. They're a very effective top-down mechanism, but we've seen over and over and over, and we actually have some great charts and data to show this in KaiNexus, where the kind of the episodic nature of the event and it then not leading to a culture of continuous improvement. So I don't think you should go into thinking, oh, we are going to develop a culture of continuous improvement by doing an event each month. That just will not happen. You'll certainly solve a lot of problems each month, but you won't kind of create that culture, if you will.
Yeah, and my understanding of the history of the Kaizen event, or what was often called the Kaizen Blitz in the United States in the 1980s, you had Shingijutsu consulting firm from Japan, flying people back and forth. It made sense to come and spend a week and then go fly home. But my understanding is that the intent of these Kaizen Blitzes was to demonstrate that improvement was possible, to spur on and inspire ongoing continuous improvement. That would be, I think, the ideal situation. If you do some events, and you're going to need events, I think, to solve relatively large systemic problems, but you should also be doing ongoing continuous improvement. We see similar things if we think about Mary Greeley Medical Center, one of our great customers. They were doing events. We helped them with something called a workout, which is a 90-day improvement blitz of everybody in every department coming up with an improvement. But Mary Greeley did that as a way to set the foundation for ongoing Kaizen, daily continuous improvement, which we also helped them with a year and a half ago, I think it was, and 2.5 years ago. And and helped them and kicked that off in a couple of departments, proved it out. Ron Smith and their team there, we've got a webinar in our library on the Mary Greeley story. There's stuff on the website about their workout success. This all ties together. Big improvement, small improvement, events, continuous improvement, episodic improvement. It can all coexist, and I think the common theme, last point I'll make, is that it's all PDCA or PDSA. Plan, do, check, act. It's all in that same style.
It's interesting, and this is really about trivia, because I don't think we're going to be able to probably get to our next questions based on time, but when I was doing all of my research for the paper that I published in Academic Emergency Medicine, where maybe people don't realize, but I'm an emergency medicine doctor that realized there was all this improvement science that could be applied to the emergency department, and published a paper on it. But when I was doing it, Berwick is often credited as the first person to talk about Kaizen. I'm sorry?
Don Berwick.
Don Berwick. I don't know. Is being credited to introduce Kaizen to healthcare. But I actually found a number of references in the literature going back to 82, 83, if my memory serves me correctly, about describing this blitz process. And interestingly enough, it was being done in the pharmacy departments. And the pharmacy departments are some of our, in at least our healthcare customers, some of our kind of most progressive departments that are applying these principles. And so I just think it's an interesting, I had totally forgotten about the blitz being kind of a predecessor to the, I mean, to me, I don't like it because it reminds me of Blitzkrieg, but I like the event as semantically better. But as really being putting the first ways Kaizen and even this was even before the term lean was coined, was finding its way into healthcare. So
Yeah.
Interesting piece of trivia.
Yeah, so I think we're going to have to wrap up today. I mean, 30 minutes goes very quickly. We got through 4 questions. We want to thank everybody who asked those questions. Greg and I think we'll try to do another Ask Us Anything, if not in May, sometime in June. We'll announce that through the website. Go to kainexus.com/webinars.
Well, those of you watching live know that my internet cut out right as we were wrapping up here. So I just want to let you know about the next webinar. It's going to be presentation format on April 25th. Kevin Meyer, one of the co-founders and partners at Gemba Academy, is going to be presenting on what he calls personal leadership at the nexus of lean and Zen. I think it's going to be a really interesting, thought-provoking topic. You can go to www.kainexus.com/webinars to register, and you'll also be notified about our upcoming Ask Us Anything. So on behalf of Greg Jacobson and the entire team at KaiNexus, we want to thank you for joining us for Ask Us Anything, and we'll see you next time.